Our digestive system is a marvel of nature, a complex and efficient system responsible for breaking down the food we eat into nutrients our body can absorb and utilize. This intricate process begins in the mouth, where teeth break down food, and saliva starts the digestive process. The journey continues through the esophagus, a muscular tube that propels food into the stomach. Imagine the stomach as a powerful churning machine, using strong acids and enzymes to break down food further. The partially digested food then moves into the small intestine, where most nutrient absorption occurs. Here, the pancreas and liver contribute enzymes and bile to aid digestion. Finally, the remaining waste products travel to the large intestine, also known as the colon, where water is absorbed and stool is formed. This incredible journey ensures our bodies receive the essential building blocks for energy, growth, and repair. Think of the digestive system as a well-orchestrated assembly line, each organ playing a crucial role in converting food into usable fuel for our bodies. However, this well-oiled machine can sometimes encounter glitches. Just as a traffic jam can disrupt the smooth flow of vehicles, certain conditions can interfere with the normal functioning of our digestive system. IBD is a group of disorders characterized by chronic inflammation in the digestive tract. This inflammation isn't a normal, helpful response to injury or infection. Instead, it's like a fire alarm that keeps ringing, even when there's no fire. This persistent inflammation damages the lining of the digestive tract, leading to a range of uncomfortable and often debilitating symptoms. Imagine a constant irritation in your gut, making it difficult to digest food properly and absorb nutrients. IBD is not a single disease, but an umbrella term encompassing several chronic inflammatory conditions, the most common being Crohn's disease and ulcerative colitis. While they share the common thread of inflammation, these conditions affect different parts of the digestive tract and manifest with varying symptoms. Understanding the different types of IBD is crucial for accurate diagnosis and effective management. The impact of IBD extends far beyond just physical discomfort. The chronic nature of this condition, with its unpredictable flare-ups and remissions, can significantly impact an individual's quality of life. It can affect their ability to work, study, socialize, and engage in everyday activities. This is why understanding IBD, recognizing its symptoms, and seeking timely medical attention are crucial in managing the disease and improving the lives of those affected. Crohn's disease, named after the American gastroenterologist Burrell Bernard Crohn, who first described it in 1932, is a chronic inflammatory bowel disease that can affect any part of the digestive tract, from the mouth to the anus. Unlike ulcerative colitis, which is limited to the colon, Crohn's disease can affect any layer of the bowel wall, earning it the label transmural. Imagine a tiny rodent gnawing its way through the layers of your digestive tract, leaving behind patches of inflammation and ulcers. In Crohn's disease, these patches of inflammation can occur in a discontinuous pattern, meaning healthy segments of the bowel might exist between inflamed areas, often described as skip lesions. The inflammation often extends deep into the layers of the bowel wall, leading to complications like strictures, narrowing of the bowel, and fistulas, abnormal connections between different parts of the bowel or between the bowel and other organs. The unpredictable nature of Crohn's disease makes it particularly challenging to manage. The location and severity of inflammation can vary greatly from person to person, and the disease can progress differently in each individual. While some individuals may experience mild symptoms with long periods of remission, others may have more aggressive disease with frequent flare-ups. The unpredictable nature of Crohn's disease often leaves patients feeling anxious and uncertain about their health. Imagine living with a digestive system that seems to have a mind of its own, flaring up unexpectedly and impacting daily life in unpredictable ways. One day, you might feel relatively well, able to enjoy a meal with friends, and the next day, you could be doubled over in pain, unable to leave the house. This unpredictability can make it difficult for individuals with Crohn's disease to plan ahead and engage in everyday activities. Social events, work commitments, and even simple errands can become a source of anxiety, as the fear of a sudden flare-up looms large. The chronic nature of the disease, coupled with the potential for serious complications, can also take a toll on mental health, leading to feelings of isolation, depression, and anxiety. Despite the challenges posed by Crohn's disease, it's important to remember that with proper management, many individuals can live full and active lives. Early diagnosis, individualized treatment plans, and lifestyle modifications can help control inflammation, minimize symptoms, and improve quality of life. Ulcerative colitis, another common type of IBD, primarily affects the colon, also known as the large intestine. Unlike Crohn's disease, which can affect any part of the digestive tract, ulcerative colitis is limited to the inner lining of the colon, causing continuous inflammation and ulcers. Imagine the colon as a long tube, and in ulcerative colitis, the inflammation typically starts in the rectum, the last part of the colon, and extends upwards in a continuous manner. The inflammation in ulcerative colitis is typically superficial, affecting only the innermost layer of the colon, known as the mucosa. This inflammation causes the lining of the colon to become red, swollen, and easily irritated, leading to the formation of ulcers. These ulcers are often described as open sores and can bleed easily, leading to blood in the stool, a common symptom of ulcerative colitis. The severity of ulcerative colitis can vary widely, from mild inflammation limited to the rectum to more extensive inflammation involving the entire colon. The disease can also fluctuate over time, with periods of active inflammation or flare-ups, alternating with periods of minimal or no symptoms, known as remission. While Crohn's disease and ulcerative colitis share the common thread of chronic inflammation in the digestive tract, they are distinct conditions with important differences in their location, pattern of inflammation, and potential complications. Understanding these differences is crucial for accurate diagnosis and tailored treatment strategies. Crohn's disease can affect any part of the digestive tract from mouth to anus, while ulcerative colitis is limited to the colon. The inflammation in Crohn's disease is transmural, meaning it can affect all layers of the bowel wall, while in ulcerative colitis, the inflammation is superficial, limited to the inner lining of the colon. Recognizing the specific symptoms and understanding the distinct characteristics of Crohn's disease and ulcerative colitis are crucial steps towards early diagnosis and effective management of these chronic conditions. While both diseases can significantly impact quality of life, advancements in medical therapies and lifestyle modifications offer hope for individuals living with these conditions. Though Crohn's disease and ulcerative colitis have distinct characteristics, they share a common language of discomfort manifested through a range of overlapping symptoms. These symptoms arise from the chronic inflammation wreaking havoc within the digestive tract, disrupting the normal functioning of this intricate system. Imagine a symphony orchestra where the instruments are out of tune, creating a cacophony instead of harmonious music. One of the most frequent complaints among IBD patients is persistent diarrhea. This isn't just a matter of inconvenience, it's a debilitating symptom that can severely impact daily life. The inflammation in the intestines disrupts the body's ability to absorb water properly, leading to loose, watery stools. In severe cases, individuals might experience dozens of bowel movements per day, leading to dehydration, fatigue, and social embarrassment. Abdominal pain, often described as cramping, is another hallmark symptom of IBD. This pain can range from a mild, dull ache to severe, debilitating cramps that leave individuals curled up in agony. The inflammation and ulcers in the digestive tract irritate the nerve endings, sending pain signals to the brain. This pain can be unpredictable, flaring up after meals, during times of stress, or for seemingly no reason at all. Section 2. Decoding the abdominal distress: pain, cramping, and bloating. The abdominal distress experienced by IBD patients extends beyond pain and diarrhea. Bloating, a feeling of fullness and tightness in the abdomen, is another common complaint. Imagine like a balloon slowly inflating within your stomach, causing discomfort and a visible distension of the abdomen. This bloating can be triggered by several factors, including gas buildup due to impaired digestion, inflammation in the bowel wall, and changes in gut bacteria. The persistent inflammation in IBD can also lead to a loss of appetite and weight loss. The body, in a state of chronic inflammation, may not efficiently absorb nutrients from food, leading to malnutrition and weight loss despite adequate food intake. Imagine a leaky faucet constantly dripping water. Similarly, the inflamed intestines may not retain the nutrients the body needs, leading to deficiencies and unintended weight loss. These digestive symptoms, while varied in their presentation, share a common origin: the persistent inflammation characteristic of IBD. Recognizing these symptoms and understanding their relationship to underlying inflammation is crucial for early diagnosis and effective management of this chronic condition. Section 3. Beyond the gut: extraintestinal manifestations of IBD. IBD's impact extends beyond the gut, causing joint pain, skin issues, and eye inflammation. Joint pain, known as arthritis, is common. Skin problems like rashes and ulcers are frequent. Eye inflammation, or uveitis, needs prompt attention. Section 4. The emotional undercurrent: living with a chronic, unpredictable disease. IBD impacts emotional well-being, creating anxiety, fear, and uncertainty. Everyday activities become stressful, and the chronic nature of the disease affects mental health. Seeking support is essential for managing both the physical and emotional impact of IBD. Despite decades of research, the exact causes of inflammatory bowel disease, or IBD, remain shrouded in mystery. It's a complex interplay of factors that scientists are still working tirelessly to unravel. Imagine a detective piecing together clues. Each clue offers a glimpse into the bigger picture but doesn't reveal the whole story. Researchers have identified key players: genetic predisposition and environmental triggers. These factors determine whether the disease manifests and how severely it progresses. The genetic predisposition to IBD is often described as inheriting a susceptibility, not the disease itself. Imagine inheriting a family recipe for a delicious cake. You have the instructions or genes, but not necessarily all the ingredients or environmental triggers needed to bake the cake and develop IBD. Studies have shown that individuals with a family history of IBD, particularly a first-degree relative, like a parent, sibling, or child, have a significantly higher risk of developing the disease compared to the general population. The closer the genetic relationship, the higher the risk. However, it's important to emphasize that most people with IBD do not have a family history of the disease. The genetic landscape of IBD is complex, involving multiple genes, each contributing a small piece to the overall risk. These genes influence various aspects of the immune system, including the body's ability to distinguish between harmless substances and potential threats. In individuals with IBD, this recognition system goes awry, leading the immune system to attack the lining of the digestive tract as if it were a foreign invader. Scientists are still unraveling the specific roles of these IBD-associated genes, hoping to gain a deeper understanding of the disease's underlying mechanisms and pave the way for more targeted therapies. Imagine solving a complex jigsaw puzzle, each gene representing a piece that, when assembled correctly, reveals a clearer picture of IBD's genetic underpinnings. Genetics lay the groundwork for IBD, but environmental factors like diet, smoking, and infections act as triggers, pushing susceptible individuals towards developing the disease. Imagine a pile of dry leaves. They remain inert until a spark ignites them, setting off a blaze. The hygiene hypothesis suggests that early exposure to infections may train the immune system, reducing the risk of autoimmune diseases like IBD. Modern hygiene practices, while reducing infectious diseases, may inadvertently contribute to the rise of autoimmune disorders. Diagnosing IBD is like solving a medical mystery, starting with a thorough medical history and physical examination. Tests and procedures help visualize the digestive tract, assess inflammation, and rule out other conditions. Blood tests offer glimpses into the inflammatory battlefield within the digestive tract, measuring markers like C-reactive protein and white blood cell counts. While blood tests provide valuable clues, further investigations like endoscopy are often required to confirm the diagnosis. Endoscopy, the gold standard for diagnosing IBD, allows physicians to directly visualize the digestive tract using a camera-equipped tube. Biopsies taken during the procedure help confirm the diagnosis and assess inflammation severity. Imaging techniques like CT and MRI scans offer a broader perspective, revealing complications that may not be visible through endoscopy alone. These techniques complement endoscopic procedures, providing a comprehensive assessment of the digestive tract. Treating IBD involves a multifaceted approach, combining medications, lifestyle modifications, and sometimes surgery to achieve and maintain remission. This personalized approach underscores the importance of a strong patient-physician partnership. Medications like aminosalicylates, corticosteroids, immunomodulators, and biologics form the cornerstone of IBD treatment, targeting different aspects of the immune system to reduce inflammation. Regular monitoring is essential to assess medication effectiveness and manage potential side effects. Surgery may become necessary when medications fail to control symptoms or complications arise, involving procedures like resection and anastomosis or proctocolectomy. Minimally invasive techniques like laparoscopy offer less pain and shorter recovery times. Lifestyle modifications, including diet, stress management, exercise, and smoking cessation, play a crucial role in managing IBD symptoms and improving quality of life. Identifying and avoiding personal trigger foods, engaging in stress-reducing activities, and maintaining a balanced diet are essential for gut health. Section 1. IBD, a journey of resilience and hope. Living with inflammatory bowel disease is undeniably challenging, marked by unpredictable flare-ups and persistent symptoms. It's like navigating a turbulent sea with periods of calm and sudden stormy waves. However, IBD is not a life sentence. It can be managed, allowing individuals to live full lives. Early detection and proactive management are key. Like a seedling, early care leads to resilience. Early diagnosis allows timely intervention. Seek medical attention at the first sign of issues. Ignoring symptoms can delay diagnosis. You are your own best advocate. Understand your IBD for informed decisions. Communicate openly with your healthcare team. Section 2. Empowering yourself. Your toolkit for a healthier future. Living with IBD is a marathon, not a sprint. Equip yourself with knowledge, tools, and support to navigate the journey ahead. Imagine yourself as an explorer. Preparation helps overcome challenges. Understand your disease, triggers, and treatment options. Knowledge empowers informed health decisions. Build a strong support system. Connect with others who understand IBD. Sharing experiences makes a difference. Lifestyle changes are crucial. Diet, exercise, and stress management improve well-being. These are pillars of IBD management. You are not defined by your IBD. It's just one chapter in your story. Write a story of resilience and hope.